We begin with breaking news tonight. A patient is being tested for the often deadly Ebola virus at a South Sacramento hospital. That patient is in isolation at this hour. It's important to note the Ebola virus is not confirmed here. Test results are not expected for several more days. Good evening. I'm Shannon Bernius.
I'm Sam Shane. Big picture for you. Centers for Disease Control and Prevention has told CBS 13 today that 60 people from California have been tested for Ebola. 10 of those tests have been sent to the CDC for further review, and so far, all 10 of those tests have come back negative. Now, for this specific case, we begin our team coverage with CBS 13's Maria Medina, live outside Kaiser South. Maria, tell us what you know about the patient being held in isolation in the hospital behind you.
Well, guys, I can tell you we have been standing out here for several hours, and no one has come out to talk to us to answer the very many questions we have.
It is shocking, yeah. I mean, I'd be really concerned with that.
With questions swirling about a possible Ebola patient being treated at this Kaiser in South Sacramento, hospital staff stayed tight-lipped, refusing to go on camera and increasing its security presence, only releasing a statement saying in part, quote, "We are working with the Sacramento County Division of Public Health regarding a patient admitted to the Kaiser Permanente South Sacramento Medical Center who may have been exposed to the Ebola virus. The CDC will be testing blood samples to rule out the presence of the virus." End quote. The patient is in isolation, likely in a room just like the 2 American patients with Ebola being treated in Atlanta. It's designed to keep patients in an extremely high level of clinical isolation.
I'm speechless. I had no idea. That's crazy.
Still, patients leaving Kaiser say no one told them about the possibility of an Ebola patient inside the hospital they just left.
Nope, they didn't tell me nothing like that.
And some, like Diane Brock, believe the staff should have told them. She just left the ER.
They should let us know that and take better care of it. If I got a virus like that from here and took it home, I would be upset.
A county health expert says it could take days to find out if the patient tests positive for the highly deadly virus, leaving many wondering, who is this patient? How did he or she possibly get exposed to Ebola? And did they infect anyone else?
And we have so many questions, including why this patient thinks that they're infected and where they came from. Again, no one has come out here to talk to us.
Okay, Maria, it's not just the hospital officials, it's public health officials who are saying nothing. I know you can't answer this, but we want to go over this with the viewers so they know what we're not being told. First of all, we don't know how or where this patient was exposed to Ebola. We don't know how long the patient's been there. We don't know the patient's age or gender. The CDC told us that 60 people in California have been tested, 10 have come back negative. What about the other 50? We don't know that. We've not heard from a public health official at any level, federal, state, or county. No one from the hospital since the story broke 4 hours ago. When is somebody going to talk here? Do you have any idea? You're getting any inclination?
Yeah, we do want to mention that we asked the CDC several times if they could confirm whether there was a possible Ebola patient. They did not confirm that at all. It wasn't until Kaiser South Sacramento actually sent a press release that we found out that this was actually happening. Now, I had the spokesperson on the phone and I said, listen, if this is a public safety issue, come out and talk to us, give us 1 or 2 sound bites. And he said, you know what, this is a decision from the top that they are just not speaking right now.
That is just really, it's mind-boggling how they're being so silent in all this. All right, thanks very much for that, Maria. Live.